Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. In this today's very important video, we are going to discuss those very important questions, concept, a fact-based questions, a golden point chanting and revision, and we are going to fix those theory-based questions which are repeatedly striking in your exams. So, without wasting a single second, here I am discussing those very important and very high yield questions. In one single particular questions, we are going to discuss at least 7 to 8 questions that is most important for our upcoming exams. Right? So, very good evening, beta. Welcome once again, everyone, to the Master Nursing classes. Here we are learning the very important things for the upcoming Norcet and other exams like KGMU, GMCH, ESIC, and all. Right? Yes, again the ESIC post will come very soon. We will announce, and JIPMAR post also are about to come. We will announce that one very soon when once the official notification comes. Right? Yes. Good evening. Good evening. Let everyone to join the class. So we'll start the class very soon. Right? Beta. If you want to stand out of the crowd and if you want to come in the final rank list, so basically two things you have to remember, that is to prevent us from the happiness. One is to comparing with others and another one is to living in the past. So never ever think about the past can't change your future. Just you have to analyze those mistakes what you have did in the last exams, and you have to come out of the those very important negatives which is making you to fail. Yes, just you have to learn from the past and move focus on the future and move on, right? And don't never ever compare with the others, right? So everyone is different in their different situations and in their different fields, right? So you are able to give the intramuscular injection very easily, right? And if you want the Virat Kohli to give the intramuscular injection to the patient, it is not possible because he is cricketer and we are healthcare professionals, right? So our work is easier to us and we are perfect in our work, and every person is having their skills and comprehensiveness in their own fields, right? So never ever compare with yourself with others, right? So keep on moving with learning the new things and best things. That is always keeps on motivates you and always updates you, and that always gives you a best result, right? So I hope everyone joined the class. We'll start the class now, right? So if anyone of you are watching the class first time, so please do like to the class and share to the class with your friends. And if you are new to the particular master nursing classes, the learning platform, so please do subscribe to the channel and hit the bell button, which is near to the subscribe button, which sends you a notification when the class will start, right? So with this beautiful, first very important basic questions, I am studying the today's class. Yes. So what is the primary focus of the Florence Nightingale's environment theory? The very simple question and very important question. What is the primary focus of the Florence Nightingale's environmental theory? Yes, the question will come. Who given the environmental theory? The environmental theory is given by the Florence Nightingale, right? So this question also will arranges. So what is the primary focus of the environmental theory? Yes. So here is a patient in the hospital. For the good and speed recovery of this particular patient, the Florence Nightingale said that the environment plays a very important role, especially a pure air, pure lightings, proper lightings, and less noise, and a good healthy environment around surround of the patient, which actually contributes in the speed recovery of the patient. So that is what the environment stands here, means the patient's surroundings in the ward okay, which we are keeping the clean, healthy, and positive means which helps in the result speed recovery of the patient, right? So that is said by the Florence Nightingale. Okay, so what is the main focus here? Option A is telling that the pharmacological intervention, no, the disease pathology, that is not going to contribute, right? Option C coming here as the change in the patient surrounding to improve the health. Yes, so changing in the patient surrounding improves the health, like a pure air, proper lighting, less noise, and all, and the clean and healthy environment, right? So that is actually contributes here in the speed recovery of the patient, said by the Florence Nightingale. And primary focus of the environmental theory is the this one, that is the changing in the patient surrounding to positive things, right? So that is the correct answer goes here is the option C, right? So let us discuss those very important golden points on the Florence Nightingale. Yes, Florence Nightingale is also called as the founder of the modern nursing. Who is the founder of the modern nursing? The Florence Nightingale is also called as the founder of the modern nursing. Very, very important point. And environmental theory is contributed by the Florence Nightingale. As I told, the main focus of the environmental theory is to change the environment of the patient to the positive, right? By improving the air quality, by proper lighting, by proper noise control techniques. So those actually contributes in the speed recovery of the patient, okay, which is the main focus of the environmental theory given by the Florence Nightingale. Okay, so this particular theory emphasizes the clean air, clean water, sanitization, and healthy environment of the for the better healing, right? So that's what I have already explained. And so Florence Nightingale played a vital and very important role in the Crimean War, because okay, here she took care of the patient who are means the soldiers who are wounded there. Okay, so that is what she used to take the night rounds in a wounded in a area of the what we can say the war, okay, with a small lamp. Okay, okay, because of that one, the Florence Nightingale is also called as the a lady with a lamp. Okay, the lady with a lamp. Why? Because the Florence Nightingale used to go to the war field, okay, by holding the small lamp to take care of the wounded soldiers. So that is what the Florence Nightingale we used to say as the lady with a lamp. Okay, that is the most important. And the first professional nursing school which opened by the Florence Nightingale. Okay, so for the training the nurses in the year of the 1860 in the Thomas St. Thomas Hospital, London. Okay, that is the one more very important thing. And one book which is launched by the Florence Nightingale, that is the Notes on Nursing. Okay, still many good name authors used to refer this book for the taking contribution in their own books, right? So that is the book which is launched by the or which is published by the what we can say the lady with a lamp or the founder of the modern nursing. That is the Florence Nightingale. That is the notes on the nursing. Okay, so that is the most important golden points on the Florence Nightingale. So all you people have to remember this one. Okay, so here is the next question. Yes, I want your answer for in the comment box. As I told, the today's questions are the fact-based questions. All you people have to remember one time. That is more than enough for the exams, right? So, what is the theme of the International Nurses Day 2025? Okay. So, what is the theme of the International Nurses Day 2025? Right. So, option A: nurses wise to lead a vision for the future healthcare. Option B: our nurses, our future. Caring for the nurses strengthens the economics. Yes, this is the actual theme for the year 2025, the International Nurses Day. Okay, so this is the correct answer. Option B goes to the correct answer here. Okay, so now my next question is, who is the responsible authority or the regulatory body which is responsible for the creating themes for the International Nurses Day? Yes, that is the International Council of the Nurses. So this is responsible for creating the themes for the International Nurses Day. So here in the year of the 2025, they said if the government, if the all regulatory bodies, or if the authorities which is responsible for the nursing education and the nursing practices, if they are taking care of the nurses, okay, nurses will take care of the patients. Okay, the patient will recover very speed. Okay, so the patient is recovering very speed and he will go to the his work back, and so he will contribute to the our particular country or our particular world, so which actually strengthens the economic of that particular country. Okay, this is the main meaning of this particular our nurses, our future. The caring for nurses will strengthens the economics. So this is the very very important theme of the year of the 2025. Okay, so hope it is clear to everyone, right? This was the theme launched by the International Council of the Nurses. Okay, already we have discussed, right? So here is the some more important points on the Florence Nightingale. Okay, so birth date of the Florence Nightingale is the 12th of the May. Okay, she born on the year of the 1820. Okay, so on this day, 12th of the May, in the honor of the birthday of the Florence Nightingale, so we used to celebrate every 12th May in the every year. So that is International Nurses Day in honor of the Florence Nightingale. Okay, because of the birth date of the Florence Nightingale. Okay, so she lived the her life for the year of the 90 years, and she died on the August 13th 1912. Okay, so sorry, 1910. So this is the very very important points all you people have to know, because this is a very simple fact. Okay, so here is the next question. So everyone, so please fatafat do comment in the comment box. Very very easy questions and very important questions which may strikes in your KGMU and JNCH exams, right? So yes, so here is the headquarter of the International Council of the Nurses located. Yes, very simple, very very important. After the your answer, I will make you for the golden point chanting on the many many very important international health regulatory bodies. Yes, where is the headquarter of the International Council of the Nurses located? It is located in the Geneva, in the Switzerland. Okay, so the most important. Let me revise the all important regulatory bodies and their headquarters. Right. So here is the headquarter of the World Health WHO. That is the World Health Organization located in the Geneva, Switzerland. Same International Council of the Nurses in the Geneva, Switzerland. Okay. The UNICEF. The headquarter of the UNICEF is in the New York. Okay. So how to remember, sir? Here is the NIU is there. So make it reverse. That's the new. Okay. So that is the New York city of the USA. You can remember, very very important. And Food and Agriculture Organization, FAO. This is the last time asked questions. Okay, so in the other GMCH exam. Okay, so the very important question again I am highlighting here. Okay, so how to remember, sir? That's the Rome and idli. You can remember idli, dosa, sambar, chutney. That is the food, right? So here it is. Food and Agriculture Organization is located in the Italy, in the Rome. Okay, so that is the most important for the remembering purpose. I told this song. Okay, hope you enjoyed that one, right? So the next one is the United Nation Population Fund. Okay, it is located in the again New York City in the USA. Okay, so then comes to the very very important International Red Cross and Red Crescent, which is located in the again Geneva, Switzerland. Right. So three questions, one answer. WHO, Geneva, Switzerland. International Council of Nurses, Geneva, Switzerland. Red Cross Society, Geneva, Switzerland. Right. So UNICEF and UNFAA, that is in the New York City, USA. Okay. Food and Agriculture Organization, so that is in the Rome, Italy. Very very important. Then the World Bank, which is located in the Washington. Okay. So then the Center of the Disease Control and Prevention, which is located in the Atlanta. Okay, so that is the Georgia city, right, in the USA country, right? So that is the very very important. Hope it is clear to everyone. So the most important four things to remember is the WHO, International Council of Nurses, FAO, then comes to the International Red Cross Society. Okay, so these are the very very important. All you people have to remember. Okay, so here's the next most important question. Yes. Where is the headquarter of the Indian Nursing Council is located? That is previously we have studied the ICN, that is the International Council for the Nurses, right? That is the international health regulatory body of the nursing education and the nursing practice. So this is the our country health regulatory body, that is the Indian Nursing Council, where it is headquarters is actually located. Yes, almost all of you know that it is in the New Delhi. Okay, so almost all health regulatory bodies are in the New Delhi, 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 New Delhi. Okay, again New Delhi, Nimans in the Bangalore. Okay, so let me quickly revise that one. Ministry of Health and Family Welfare, yes, of course it is in the New Delhi. Indian Council for the Medical Research in the New Delhi. National Medical Commission also is in the New Delhi. Central Drug Standard Control Organization, that is the CDSCO in the New Delhi. Pharmacy Council of India in the New Delhi. Indian Nursing Council in the New Delhi. And National Health Authority in the New Delhi. Food Safety and the Standard Authority of India, very, very important. Okay, so in the New Delhi again. So then comes to the All India Institute of the Medical Science, AIMS, the dream of the every nursing officer. That is the AIMS New Delhi main campus. Okay, so the National Institute of the Mental Health and the Neuroscience, our proud, that is the NIMHANS in the Bangalore. Okay, so this is the very, very important points all people have to remember here. Okay, so let me go for the next most important question. I'm waiting for your answer here in the comment box. Yes, these are the very fact-based questions we people have to know and remember before going to the main exams. Okay, at the end of this class, all you people have to take a screenshot with this one. Okay, revise at least 2 times and finish it here only. Okay, because once you are going through this particular content means no need of the revision. Also, you will get the correct answer in the exams, right? So just once you people have to go through with this one. Okay, that's the main important things. Yes, the next question is, who is the founder of International Red Cross Society? The most important question for your KGMU JMCH exam. Most important question: who is the founder of the International Red Cross Society? Yes, option A, Florence Nightingale. All point we have studied on the Florence Nightingale. Then the Clara Barton, Henry Dunant, Louis Pasteur. Macho, the answer goes here. The HD, that is the Henry Donald, is the our founder of the International Red Cross Society. If the question is arising, the Indian Red Cross Society, the answer is different. Indian answer is different. What is the answer? Let me revise. So just now know the answer for this question. The International Red Cross Society founder is the Henry Dunant. Okay, so let me explain you actually the Indian Red Cross Society and International Red Cross Society. Very, very important thing. The headquarter of the Indian Red Cross Society again in the India. Just we have seen in the last question, and International Red Cross Society. This one also we have seen in the Geneva in the Switzerland. The most important, and the founder of the Indian Red Cross Society is the Sir Cloudy Hill. Okay, Sir Cloudy Hill is the founder of the Indian Red Cross Society, which is actually inspired by the International Red Cross Society. Okay, so the founder of the International Red Cross Society is the Henry Dunant, is the founder of the International Red Cross Society. Okay, so the International Red Cross Society, which is this established in the year of the 1863, and our Indian Red Cross Society, which is established in the year of the 1920. Okay, so in the year of the 1920 we established the Indian Red Cross Society. Okay, so what is the main aim and purpose and work of the Red Cross Society? Is very simple. Whenever there is the mass casualty or the mass disaster or the mass human and the property losses will be there the volunteers team will go and assist them. They will support them in the disaster time, okay, in the conflicts time and in the war time. Okay, so that is the very, very important thing. In the international areas, the International Red Cross Society will be responsible for that one. There is the global humanitarian aid and conflict relief and disaster and at the worldwide, that is the International Red Cross Society. And the Indian Red Cross Society is again responsible for the disaster relief and blood donation, health services in the India. So these are the work, especially at the emergency and the disaster times. The Red Cross Society will be always stands with the country and with the world. So to for the speed recovery and to reduce the impact and the bad effect of the particular disasters or the wars, right? So this is the very, very important golden points all people have to know and remember related to the Red Cross Society. Hope the answer is clear and the explanation is very much helpful to you people. Take a screenshot of this particular board, right? So here is the next most important question. Who is considered the first psychiatric nurse? Fatafat, do comment in the comment box. Very simple, easy, important question, and After the completion of this question, I will make you people to remember those very important golden points that is much necessary for the exams, right? Who is considered for the first psychiatric nurse? First psychiatric nurse is, yes, almost all you have people have given the best shot. So that is the Linda Richard is considered as the first psychiatric nurse. Okay, so the very important and basic question. And now I want the answer for this all question. Yes, try to give the best answer. Who is called as the uh, founder of the Red Cross Society? Already we have discussed. There is the International Red Cross Society is the Henry Dunant. If just the examiner is asking the question, okay, just the examiner is asking the question, just Red Cross, then also Henry Dunant. When the examiner throw a question, Indian Red Cross, then the answer will change. Sir Cloudy Hill is the answer. Okay, so then what we have discussed, one more question, that is the uh, first psychiatric nurse we have discussed, that is the Linda Richard is the also called as the first psychiatric nurse. So we have discussed this one already and we know the answer. Okay, so now tell me the answer for this above question. Who is the father of the medicine? Yes, Fadafat start to comment in the comment box. Who is the father of the medicine? Fadafat, well done, beta, well done. So the father of the medicine is the Hippocrates, is also known as the father of the medicine. The next question is, who is the father of microbiology? Who is the father of the microbiology? Fadafat, I want answer in the comment box. So be active, full active. I want full active participation in the comment box, right? The father of the microbiology is the very basic, simple questions today I have opted for you people, right? So that is the father of the microbiology is the Louis Pasteur is called as the father of the microbiology. Okay. So then next, the father of the immunology. I want the answer. The father of the immunology. Who is the father of the immunology? Yes, Fadafat. I'm waiting for your response. Who is the father of the immunology? Yes. Edward Jenner is also known as the father of the immunology, and Edward Jenner is also known as the father of the vaccine, and he discovered the first vaccine against the smallpox. Okay, so that is what the father of the immunology is, the Edward Jenner, and the father of the vaccine is the Edward Jenner. Okay, so that is the most important golden point for your exam. Okay, so is the father of the anatomy. Yes, the Vasalis is the father of the anatomy. So, in simple, we call him as the Andrews Vasalis. Okay, so who is the father of the anatomy? That is the Andrews Vasalis is the father of the anatomy. The most important question, right? So, the next comes to the next question. That is, who is the father of the bacteriology? Yes, the person who discovered the TB bacteria. That is the Mycobacterium tuberculosis. He is considered as the father of the bacteriology, that is the Robert Koch. Okay, so the father of the bacteriology is the Robert, the boss, the Koch. Okay, so the Robert Koch is considered as the uh, father of the bacteriology. He discovered the Mycobacterium tuberculosis. Okay, so that is what the pulmonary TB is also called as the Koch disease. Okay, so what is the another name of the tuberculosis? That is the Koch disease, which is named by the scientist Robert Koch. Okay, so sometime anti-tubercular therapy. Okay, that is the ATT drugs what we are giving, the isoniazid, rifampicin, ethambutol, and other drugs. Okay, so the ATT drugs. So sometimes the ATT drugs also called as the anti-Koch therapy. Okay, what we can say anti-Koch therapy, right? So the Robert Koch is also called as the father of the bacteriology and who discovered the TB. Okay, so the next very important question: father of the public health. Who is the father of the public health? Yes, so I will keep this one assignment to you people. Okay, so mention in the comment box who is the father of the public health, right? The next question is the mother of the psychiatric nursing. Who is considered as the mother of the psychiatric nursing? Who is considered as the mother of the psychiatric nursing? Yes, that's the Hildegard Paplu is considered as the mother of the psychiatric nursing, and who is the founder of the interpersonal relationship theory. Okay, so IPR theory or the interpersonal relationship theory was established by the Hildegard Paplu. Because of this one, so we call as the Hildegard Papula is the mother of the psychiatric nursing. The most important question and important for you people. Okay, so IPR is first discovered or established by the Hildegard Papula, and the importance of the interpersonal relationship theory is explained by the Hildegard Papula. Okay, so that is the most important question. Okay, so then founder of the Red Cross already discussed one. That is the Henry Dunant, and founder of the modern nursing already discussed question. That is the our Florence Nightingale. And here is the assignment to you people, who is the father of the public health. Okay, so at the end of this particular very important video, all you people have to comment this answer. Okay, so note it down, who is the father of the public health. So just you people have to mention in the comment box at the end of this particular very important class, right? So the next very important question is here in front of you people. फटाफट do answer the question फटाफट बच्चों. रुकना नहीं है, थकना नहीं है, झुकना नहीं, तब तक सिलेक्शन लिस्ट में नाम नहीं आता, तब तक हमें रुकना नहीं है. राइट, keeps on trying, keeps on preparing, keeps on doing your best. The best result is yet to come, about to come. Right, जो भी मिस्टेक्स हमने किया है नॉर्सेट 8 में, so we have to come out of that one by practicing the good questions, by practicing the good concept, and by knowing the good content. Right, so we are here to give the best content always, so don't worry about that one. And I'm here to make you a golden points, a very important content, quick revision. Again, I will take a classes for the Norcet 9 also for your quick revision purpose, free of cost. Don't have to worry about that one. Okay, so always keeps on engaging on the daily regular classes. That will be helpful to you people also, right? So who proposed the self-care deficit nursing theory? So that is the a very important and basic question again here. Yes, again the Florence Nightingale, Hildegard Papula, Dorothy Oram, and Virginia Anderson. So what is the correct answer? The correct answer is the self-care deficit theory is established by the Dorothea Oram. Okay, so Oram's self-care deficit theory we used to say. Okay, so let me golden point do the golden point chanting here. So environmental theory is given by the Florence Nightingale, self-care deficit theory is given by the Dorothy Oram, interpersonal relationship theory is given by the Hildegard Papula. Just now we have discussed, and nursing need theory is given by the Virginia Anderson. Okay, so adaptation model theory is given by the sister Calista Roy. Okay, so who given the adaptation model? Adaptation model is given by the sister Calista Roy. Right, so the nursing need theory is given by the Virginia Anderson, and interpersonal relationship theory is given by the Hildegard Papula. Self-care deficit theory is given by the Dorothy Oram, and environmental theory is given by the Florence Nightingale. Okay, so these are the very important and the most basic questions that is much necessary for you people. Okay, so as a fact-based questions, right? Here is the next most important question for you people. What is the most common site for performing lumbar puncture in infants and children? Focus. Okay, now answer to the question. I'm waiting for your responses in the comment box. Fadafat, give your response in the comment box. What is the most common site for performing the lumbar puncture in the infant and in the children's? Option E, L1, L2. Option B, L3, L4. Option C, L4, L5. Option D, T12 to L11. What is the correct answer? Yes? Yes, almost all you people have given the correct answer. That is the L4, L5 is the accurate site where we have to give the puncture for the taking the CSF sample, or we can say the site of lumbar puncture in the infants and children is the L4, L5. If the question is asking for the adults, so your answer will be L3, L4. The best site, no infant, no adult. Only the question is asking the best site for performing the lumbar puncture, L3, L4. Okay, always consider as an adult. Okay, so then give the answer. If the examiner specially mentioning the infants and children, the best site is asking that is the L4, L5. Adult, that is the L3, L4. Only just mentioning the best site, that's the answer is the L4, L3, L4. Okay, so why like this? why there is change in the site. Let me explain it, the a core concept that is most important. Bacho, these are our vertebral bones. Okay, so these are our vertebral bones. Okay, this is the intervertebral disc, and here we are having the meningeal layers. Outer one is the, yes, the dura mater. Then after, the middle one is the, yes, what is the middle one? Arachnoid matter. And inside one is the pia matter. Okay, so here in the between the uh, dura mater and arachnoid matter, so here is the subdural space. Okay, so here when we come inside, so between the PM matter and arachnoid matter, here is the subarachnoid space. Okay, so in the subarachnoid space only our CSF will flow. So when we start to insert the needle here, so we are going till the subarachnoid space, right? So here inside, are you people able to see these are the nerve bundles? Okay, this is the spinal cord. Okay, this is the spinal cord, and this one is the end of the spinal cord. So we call this one as in the, yes, the conus medullaris. Okay, so that is the, which is like a cone shape. Okay, which is like a cone shape. So we call this one as the conus medullaris. So in the adult, so this is in the adult, the end of the spinal cord will be there at the L1 level. Okay, if I am inserting the needle above the L1 level, means I will damage the spinal cord, so that is I don't want. Okay, I am inserting at the L1 level, again I will damage the spinal cord, I don't want. So the best site of insertion of the needle, I will leave the L1 and I will take a chance at the level of the L3 and L4. Why? Because so L2 also there is risk is there, so I will leave that one also, and I will take risk at the L3 and L4 is the best site. Okay, so that is the lumbar 3 and lumbar 4 is the best site where there is the highest lowest risk of the spinal cord injury is there. So I can prick here. Okay, but when you see in the infants and in the children's, okay, so the spinal cord or the conus medullaris extended till the L3 level. So I will give the gap, okay, till the L3 level, and I will prick between the L4 and L5. Okay, so this is the L4 and this is the L5. So I will prick between the L4 and L5, and I will take the sample in order to again prevent the spinal cord injury, because in the children's the spinal cord extended till the L3. Okay, so in the infant also spinal cord extended till L3. Okay, in the adult the spinal cord extended till L1. Okay, the question will come, in the adult the conus medullaris level will be, in the adults the conus medullaris level will be, or we can say in the adults the level of the spinal cord will be extended till, yes, till the L1 level, or conus medullaris or the spinal cord extended till the L1 level in the adults. In the infants and in the children's, the conus medullaris or the spinal cord extended till the L3 level. Okay, so the best site of the insertion of the needle in the adults, that is between the L3 and L4. Okay, the best site of insertion of the needle for the collection of the CSF sample in the infants and children, that is between the L4, L5. So our answer goes here as the L4, L5 is the correct answer. Take a screenshot of this very important chart box here. Okay, so that is very much helpful for you people. In the children and adults, okay, end of the conus medullaris happens at the L3 level. So we have to, in order to avoid the spinal cord injury, so the puncture should be taken at the level of the between the L4 and L5. Okay, so in the adults, the conus medullaris will be ends at the around the L1 level and L2 level. So the main one single best answer is the L1 level. So we will skip the L2 also, and we will take the puncture at the L3 and L4. So this is the very important for you people. Okay, so this is the very important box to you people. And here is the next most important question. A basic question, important question. Just apply the trick here, so the answer will come. Yes, a patient has the systolic blood pressure of the 120 mm of Hg and diastolic blood pressure of the 80 mm of Hg. What is the correct ratio of the systolic blood pressure, diastolic blood pressure, and pulse pressure? What is pulse pressure? Which is simple. The pulse pressure is equal to systolic blood pressure minus diastolic blood pressure, right? So the systolic blood pressure which is given here is the 120, and the diastolic blood pressure is the 80. So the pulse pressure comes here as the 40 mm of Hg. Okay, so the question asking here is the SBP is to DBP is to pulse pressure. Okay, so what is our SBP? They have given already in the question. That is the 120. And what is the DBP? That is given in the option. That is the question only. That is the 80. Then what is the pulse pressure? That is we have found here now. Just that is the 40. Okay. So what is the ratio comes here is the 41 ja, 42 ja, 43 ja. Okay, so the answer comes here as the 3 is to 2 is to 1. Okay, so this is the answer. Just need to apply the trick and bring the answer. Okay, the standard also, that is the 3 is to 2 is to 1. So this goes to the correct answer. This is how we have to choose the correct answer here. Okay, so hope everyone is clear with this one, and many of you have given the already correct answer. So I'm very, 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 very proud of you people, right? So yes, this is the very simple question. So the next very important question is here. That is, during the massive blood transfusion in trauma or in the hemorrhagic shock, what is the recommended ratio of the PRBC, the fresh frozen plasma, and the platelets to approximate whole blood, minimize the coagulopathy? Bachcho, all of you know that what is the massive blood transfusion? What is the massive blood transfusion? It means we are providing more than 10 units of the blood, okay, in 24 hours, or we can say more than 4 units of the blood in 1 hours. So this much rapidly I am transfusing the patient means there is chance of the coagulopathy. There is chance of the coagulopathy as a form of the complication. In order to prevent this coagulopathy, I have to choose all the components. Means RBC also in the equal ratio, platelet also in the equal ratio, and the fresh frozen plasma also in the equal ratio. Okay, so this all should be equal in order to prevent the coagulopathy. Okay, only I am transfusing the PRBC means that is not going to helpful because there is in the massive blood loss will be there in the trauma patient. So in the trauma patient only will go for the massive blood transfusion. Okay. So here the only patient came with the anemia means I will only transfuse the platelet, sorry, the PRBC, right? So only the patient is came with the thrombocytopenia means I will give only the platelets. Okay. So if the only patient came with the dengue and thrombocytopenia, I will only give the platelets because there in the dengue, the RBC will be normal and the clotting factors will be normal. Only the platelet deficit will be there. So I will transfuse the platelet. Okay. In case of the anemia, okay, in the anemia only red blood cells will be deficit. So I will replace the red blood cells only. There is no need for the platelet and the clotting factors. Okay. So in case of the trauma or accident or in the any case of the massive blood loss, so there is equal loss of the plasma also, equal loss of the RBC also, platelet also, WBC also. At that particular time I need to replace the whole blood. Whole blood includes the RBC, platelet and fresh frozen plasma. Okay, so in order to avoid the coagulopathy I have to give these all three equally. Okay, so the ratio of this on is, yes, I want your answer in the comment box. Do comment. Yes, option is 1 is to 1 is to 1. Option B 2 is to 1 is to 1. Option C 1 is to 2 is to 1. Option D 3 is to 2 is to 1. Bachcho, here all should I am replacing in the equal form. Okay, so the answer goes here as the 1 is to 1 is to 1. Okay, 1 pint RBC I will replace, then 1 pint platelet, then 1 pint what we can say the fresh frozen plasma. So that is the correct answer goes here as the option A is the correct answer. Okay, hope it is clear to all you people, right? Yes, very nice of you all, right? So here's the next and most important question. Which of the following type of the intracranial hemorrhage is most characteristically associated with a lucid interval after a head trauma? So let me clear what is lucid interval. The very, very and very important concept for the exam purpose, especially competitive exam purpose. Okay, so that is the what is lucid interval. Okay, in the head trauma. Lucid interval in the head trauma stands here as, consider he is the Romeo who is on bike, okay, coming very speed, coming very, very speed, and just he fell down from the bike. Okay, so now he is lying in the road and his head is stuck to the road. Now he got with the head injury. Okay, so now the patient is got with the head injury. Suddenly, after getting the head injury, there is brief loss of the consciousness. Okay, there is brief loss of consciousness. Okay, for just a second or the 3 second, 4 second. Then comes to the normal level of consciousness. So this is what we call as the lucid interval. Then the directly patient will go for the coma. Okay. So after loss of the brief level of the consciousness, the patient will comes to the normal level of the consciousness. Here it is not loss of the consciousness. This is the normal level of the consciousness. Okay. So and directly patient lands into the coma. So between this brief loss of consciousness and coma, the patient is completely awake and alive and conscious. So this particular period we call as in the lucid interval, which happens due to the damage to the very very important artery called as the middle meningeal artery. Okay, so here there is in the damage to the artery, means there is sudden rapid expansion of the blood in the intracranial area, especially in the uh, area called as the subdural hemorrhage, or we can say subdural hematoma. In this one there is chance of the damage to the middle meningeal artery. So because of damage to this particular very important middle meningeal artery, so the patient will lands into the a very very important interval, what we call as the lucid interval. Okay, there's the brief the gap between the brief level of consciousness and coma, the patient is awake and alive. So that interval we call as the lucid interval, so which is mostly characteristically and classically seen in the case of the epidural hematoma. So this is the very very important question for your upcoming exam. Okay, so this is very very important question for your upcoming exam. And hope every one of you have enjoyed the today's class and content and rapid revision of the golden points and very important points, bacho. So this is how we used to study in a short period the heavy content. Okay, so that is much necessary for the exam. Now all you people have to revise the content what we have studied in the this particular 1 hour of the time. Okay, and here is the special assignment to you people. Okay, so the assignment is very simple. So just all you people have to mention the name of the two very important sign in the head injury. Okay, so that is the, if the patient found bruises behind the ear. Okay, so behind the ear, if the patient is found any bruises or the redness or the ecchymosis behind the ear, so what we call this sign, what is the name of this sign? And the bruises around surround of the eyes. Okay, so periocular ecchymosis. Okay, what we can say for the periocular ecchymosis? Okay, so I want the name of these very important two signs. Okay, so who will give the best and correct answer in the comment box at the end of the class? I will take a name of that particular student in the next video. Okay, so yes, so please do mention the comment in the comment box. The three very important assignment I have given the name of the signs in the head injury, that is the retroauricular ecchymosis, or one was the periauricular ecchymosis, that is the behind the ear bruises we can say, or behind the around surround of the eye bruises. So two very important sign name I want. Okay, and one more very important assignment I have given here is the, who is the father of the public health. Okay, three very important assignment all you people have to mention in the comment box the most important question and whatever the important thing we have discussed today. So that is the highly high yield and very important questions that may strikes in your exams. Okay, so I will give this particular content questions what we have discussed in the test series as well. Okay, so if anyone of you are watching the master nursing classes first time, okay, do subscribe to the channel and hit the like button and share the classes to your students. And if you are still not a part of the our master nursing classes test series, the Norcet 9 Navagraha plan for the best and better rank, so I will give the link in the description box. So please do download the master nursing classes app and enroll the best test series of the Indian nursing education, right? So I will wind up the class, today's class here. Hope you people enjoyed the class and don't forget to mention the correct answer in the comment box on the assignment. Okay, so let me meet in the next class. Tab tak ke liye jai hind, jai bharat, take care, love you all, bye bye.